African traditional medicines are good, but would you trust a concoction of assorted roots, barks, and leaves from exotic shrubs to treat malaria, diarrhea, ulcers, arthritis, STIs, microbial infections, and even cancer? Well, for most South Sudanese, this is their reality. Community health in Africa has always revolved around a traditional medicine man who had great healing skills from a vast knowledge of the cause, symptoms, and cures for many common ailments. Verified records show that some of them could even perform brain surgeries. This medical knowledge was highly valued and therefore closely guarded in these ancient communities. But with the advent of colonialism, the African medical industry was totally dismantled. Most African communities presently have neither their traditional doctors nor modern doctors. Upper Boma is located on a plateau and is occupied by the Murle and the Kachipo tribes. These communities are isolated due to their location being on top of a table mountain. They have absolutely no access to basic healthcare services. Can you imagine living here without a simple painkiller for your headache? Can you imagine living without anti-malarial drugs in a continent where malaria kills almost 500,000 people every single year? Can you imagine a people living without antiseptics and wound dressings for the deep cuts and bruises that they get from living in the wild? Can you picture people consuming unpurified and contaminated water on a daily basis, exposing themselves to pathogenic microorganisms that can cause cholera, dysentery, amoebiasis, and even hepatitis A? Can you imagine a pregnant woman with no inkling of prenatal care and delivering under unhygienic conditions without a qualified birth attendant who can handle complications? And imagine raising that baby, growing up having received no immunization against common killer diseases like polio, diphtheria, and tetanus. Can you imagine these kids growing up without any deworming and nutritive care? Can you picture how the disabled survive in such societies? Who cares for the physically challenged? Who cares for the mentally challenged? Imagine kids playing in water infested with guinea worms and playing on soil infested with jiggers. Imagine how these people cope with terminal and highly infectious diseases like cancer and HIV/AIDS. For me, I don't need my imagination because for the past 7 years, I have seen and shared in their sufferings as a good soldier of Jesus Christ. I have handled cases ranging from women in labor to fatal wounds to seizures I knew nothing about. I have seen things that have scarred me for life. I recall a woman who stabbed one of her twins so that the other could survive because she was sick and couldn't suckle them both. I'm not a trained medic, but they had to trust somebody with their problems, and I became that somebody who carried their hopes, just as Christ also carried my hopes. Our efforts to bring them medical services, unfortunately, are not enough. We need trained medical personnel, as we currently have none. We need more drugs and medical equipment in order to save lives, to ease pain, and to ensure a healthy and productive population in this region of South Sudan. My appeal to you is to pray for these people and to consider a donation towards this mission. A $10 donation, for example, can buy drugs that can save a malaria patient's life. But one can as well donate drugs and equipment and one's own talents by visiting Boma and help take care of the sick. Thank you so much for watching. God bless you. Bye.